Welcome, curious minds. Today, we're exploring something really important, a topic that keeps coming up and holds, well, a lot of hope for mental health: ketamine. Specifically, we're looking at how effective it might be for people dealing with really severe, persistent depression. This is part of our ongoing conversation about ketamine's real-world effectiveness. Our main focus today is a brand new study. It's called Real-World Effectiveness of Maintenance Ketamine Infusions for Treatment-Resistant Depression in Major Depressive Disorder and Bipolar Disorder. Big title, but basically it's looking at how ketamine works outside the lab. This research, just out in Psychiatry Research in 2025, comes from a team including Sapan Ikazian, Roger S. McIntyre, and several others, Joshua Rosenblatt among them.
That's right. And it's so important because, for anyone out there or maybe someone, who's been through the ringer with depression treatments that just haven't worked, well, this could offer some real insight. We're going to focus on how ketamine might not just give that quick relief we sometimes hear about, but potentially offer sustained benefits, keeping people well over time.
Absolutely.
Yeah.
That sustainability is key. Let's maybe start by setting the scene. What exactly are we talking about when we say treatment-resistant depression? So many people, unfortunately, experience major depressive disorder, MDD, but for some, it becomes what's called treatment-resistant depression, or TRD. That means, the standard approaches to different therapies, multiple medications, they just haven't provided enough relief. It's a really, really tough spot to be in. People are often desperate for something else.
Exactly. And it's not just MDD. The study also looked closely at treatment-resistant bipolar depression, TRBD. Similar challenges there, finding things that work consistently long-term. Both are incredibly difficult conditions.
Yeah, we've talked before about ketamine's rapid effects, how quickly it can sometimes lift that depressive fog. I think that was in our discussion on extending the benefits of ketamine treatment. But, and this is the big but, right? Those initial effects often fade pretty quickly.
That's been the major hurdle, hasn't it? You get this amazing relief, sometimes within hours of an infusion, but then poof, within maybe 1 or 2 weeks, those positive feelings can start to disappear. That transience, that temporary nature makes it really hard to use as a long-term strategy for chronic depression. And that's exactly why this whole idea of maintenance treatment is so crucial. How do you keep the benefit going?
Okay, so the researchers behind this study decided to tackle that head on. They looked at these maintenance ketamine infusions in actual clinical practice.
Right. They did what's called a retrospective chart review. Basically, they went back and looked at the medical records of patients who'd already received ketamine at a community treatment center. It's a very practical approach. It shows you what's happening on the ground, day to day.
How many patients were involved in this review?
It was a decent number. They included 110 patients with TRD and 25 with TRBD. And what's really significant here is that this is actually the first study to specifically look at maintenance ketamine for TRBD patients alongside the TRD group.
That's interesting. So, expanding the scope a bit, what does a maintenance infusion actually involve for these patients?
Well, it generally means getting regular IV ketamine infusions, but less frequently than the initial intensive course, maybe once every 2 weeks, sometimes stretching out to once every few months. The goal is to maintain those antidepressant effects they saw initially. And the clinicians in this real-world setting were aiming to gradually space out the infusions over time, kind of like what's suggested for the approved nasal spray, esketamine.
Right, finding that balance to keep symptoms managed. So the big question then, did these maintenance infusions actually work? What did the study find?
The findings were really quite positive. Patients showed statistically significant drops in their depression scores after the initial set of infusions. And, this is the key part, those improvements held steady throughout the maintenance phase. Plus, patients themselves reported feeling better overall. Their global improvement scores back this up strongly. It wasn't just numbers. People felt the difference.
That sustained improvement is huge. What about the duration? Did they get a sense of how long the benefits lasted before symptoms might have started to return the time to relapse?
Yeah, this is where the study offers some really unique data. Actually, the first time we're seeing these kinds of stats from a maintenance trial. For the TRD group, the average time to relapse was about 84 days, so roughly 12 weeks.
Wow, okay.
But interestingly, the median time, meaning half the patients relapsed before this point, half after, was 44 days, so closer to 6 weeks.
Ah, so quite a range in response then.
Exactly. It highlights that individual responses vary a lot. Some people got much longer benefit, pulling that average up. For the TRBD patients, the average time was about 75 days, so around 10 and a half weeks. Even that median of 6 weeks for the TRD group, though, is a big step up from the 1 or 2 weeks of benefit often seen after just a single infusion. It suggests maintenance really can extend that period of wellness.
Absolutely. Going from maybe a week or two of relief to potentially 6 weeks or even 12 weeks or more for some. That's life-changing for someone battling chronic depression. It's reclaiming significant time.
And what about suicidality? That's such a critical aspect of severe depression.
Right. They looked at that specifically using an item on the self-report questionnaire, and they found significant reductions in suicidal thoughts from the start, right through all the later infusions. Importantly, those lower scores were maintained throughout the maintenance period. So it adds more weight to the idea that maintenance ketamine can have a lasting anti-suicidal effect too.
That's incredibly powerful news. Reducing suicidality long-term is a major goal. Okay, so effectiveness looks promising. What about the safety side of things? We know ketamine can have side effects. We've touched on that in discussions like therapeutic potential versus the risks of heavy use and also dosing strategies. How did it look with these repeated maintenance infusions in the real world? Good question. The study concluded it was relatively safe for maintenance. Really importantly, they didn't see any cases of suicidal behavior or addiction developing during the entire treatment time. That's often a big concern people have. There was one patient who was in the TRBD group, about 4% of them, who experienced something called affective switching. That's basically a shift from depression into mania or hypomania.
Okay.
But that patient stabilized and there weren't further issues, so it was rare and seemingly manageable in this context.
And the more common temporary side effects during or right after the infusion?
Those were generally minimal and pretty much what we've seen in other studies. Things like temporary increases in blood pressure or heart rate, maybe some nausea, dizziness, headache, perhaps some visual changes or feeling a bit confused, and that feeling of dissociation, sort of feeling detached. But the key thing is, these side effects typically resolved within about an hour after the infusion finished, so short-lived and manageable.
That all sounds very positive, especially for people who felt like they'd run out of options. But you mentioned this was a retrospective chart review, a real-world study, not a randomized controlled trial, sort of gold standard. How does that affect how we interpret these results? What are the limitations we need to keep in mind?
That's a really important point to make. This real-world data is super valuable because it shows what happens in actual practice, but it definitely has limitations. The biggest one is the lack of a control group, people who didn't get ketamine or got a placebo. Without that, we can't say with absolute certainty that ketamine caused all the improvement we saw. It shows a strong link, a strong association, but not definitive cause and effect for every single person. Also, these patients were usually taking other psychiatric meds too. So ketamine was an add-on treatment, an adjunctive therapy not tested in isolation, which again is realistic, but makes it hard to separate out just the ketamine effect.
Right. So if we can't say for sure it caused the improvement because there's no control group, how should doctors and patients think about this? It sounds promising, but how do you weigh that lack of definitive proof?
It's about weighing the evidence. What this study tells us is that in practice, when added to existing treatments for very difficult cases, maintenance ketamine appears to be associated with significant sustained improvement for many. For a clinician seeing a patient who isn't getting better, this real-world evidence is compelling. It suggests this is a viable strategy that's working for others in similar situations. We see a strong signal, even if we can't isolate causation perfectly from this study alone. It points towards utility.
And I guess in the real world, things aren't standardized like in a trial. People might have had infusions at slightly different times.
Exactly. The time between maintenance infusions wasn't identical for everyone, and even the number of initial acute infusions varied. This reflects the messy reality of healthcare, right? Finances, how the patient feels they're doing, convenience, all these things play a role. It makes the data less clean than a controlled trial, adds variability.
But maybe makes it more applicable to other real-world patients.
That's the flip side, exactly. While it's a limitation from a pure research standpoint, that variability, that heterogeneity, actually makes the findings potentially more relevant to what happens in everyday clinics. It shows ketamine working amidst that real-world complexity.
So maybe not the gold standard trial, but a really vital snapshot of ketamine's potential impact when used long-term in the community.
Precisely. And it definitely underscores why we still need more rigorous controlled studies like we've discussed before when talking about different delivery methods or optimizing treatment, ketamine's 9 lives, subcutaneous ketamine. We need those to confirm these findings and refine the approach.
So bringing it back to our listener, what's the main takeaway from this study about the future for treating these really tough depressive conditions?
I think it offers really compelling, though still preliminary, support for maintenance ketamine infusions as a genuinely useful long-term strategy. It suggests that the rapid, powerful relief ketamine can bring doesn't have to be just a temporary flash. For many people, it seems it can be sustained over months. That offers tremendous hope.
It really does feel like a significant step. Moving beyond just acute rescue to potentially providing enduring stability for people who've suffered for so long, it hints at a different way of managing chronic mental illness.
Absolutely. The hope is definitely that with more research and careful use in clinics, treatments like this can become more accessible and help people achieve long-term well-being. It could really change the landscape for treatment-resistant depression.
It makes you wonder, doesn't it? If this kind of sustained, real-world effectiveness holds up, could it genuinely revolutionize what we think is possible for people who felt they had no options left? What might that mean for managing chronic mental health care overall? Lots to think about there. Thank you for joining us for this exploration today.
And thanks to all of you for listening. Keep asking questions, keep learning, and stay curious.